friends, myself Dr. Aishna Sharma. Today I am going to discuss about the topic that is very common and in general everyone suffers from it. It is tooth sensitivity. Tooth sensitivity is basically any kind of pain that you have experienced because of extremes like hot and cold, either food or drinks, or even with a blow of air. Now, first of all, going into the deep into this topic, first of all we need to understand the tooth structure. That is, a tooth, it consists of three layers. The outermost layer is the enamel, that is considered to be the hardest substance on earth, harder than diamond. So after enamel it comes dentin. Dentin is considered to be softer substance. It has tubules in it. Tubules that starts from the outer layer of the dentin and it ends up to the pulp. This dentin, and inside dentin comes the pulp or the nerve tissue. This nerve tissue consists of sensations. And whatever we eat, whatever we have, all the sensation is passed through the nerves, and it reaches through the dentin and then it reaches to the enamel. Now, whenever we have sensitivity, it means that tooth structure is lost because of any reasons. There are many reasons. Now, first and foremost reason is the loss of gum tissue. The loss of gum tissue can occur like when we take some very, very acidic things like Pepsi, Coke, or any added drinks. So in that case, our gum tissue, they are soft in nature, so they just get lost. When they get lost, the lower part of a tooth, that is the root of the tooth, it get exposed, and it is sensitive in nature. So obviously you will have sensitivity over that area. The sensitivity is not in the tooth structure, it is in the root area. Now, other reason of sensitivity is decay, and it is the most common. When you will have decay, and first and foremost you can get to know about the decay is when your food will get lodged. When the food will get lodged only in the outer surface of the tooth, that is the enamel, you won't have any sensitivity. You will just have the complaint of getting the food lodgement. But when it reaches the dentin, you will definitely have sensitivity. The first sensitivity you're going to have is of cold. After that, it's going to be hot, and after that, when it is very nearer to the nerve, you will have sensitivity to sweet. Now, this is how this process of decay starts from sensitivity and ends up in pain, because when we reach the nerve, you will experience pain. Other reason of sensitivity is fracture. When a tooth gets fractured, so obviously in fracture case also the dentin is getting exposed, and even at times the pulp or the nerve tissue get exposed. So all the sensation, whatever you eat or drink, pass on to the tooth directly, to the inside of the tooth directly, and you will have sensation to hot and cold, even to sweet. Now, what is the treatment line for sensitivity? The first and foremost treatment line, or the most common treatment line that people do at home, is the desensitizing paste. Nowadays, there's so many advertisements coming on national television. So this desensitizing paste is something that you have to use regularly, and slowly you will attain the result. But yeah, if you don't get result with the desensitizing paste, you have to come to the clinic, to the doctor's place, and you have to get it treated by the fluoridated toothpaste that doctor is going to put. Even after that, if you're not getting relief, then you have to go for the filling. That filling is medicated fillings and all. And at times, if it is your bad luck that you don't even get relief with the filling, then you have to go for a root canal. Only after then the sensitivity would be relieved. And in case you want to get the further detail about this topic, you can call me or chat with me. There's live chat option also on Lybrate.com, and you can visit our clinic, that is Rohini Dental Care, and it is in Sector 31 Gurgaon. Rest details you can get from the Lybrate.